So we can start?
Yes.
Okay. So good evening, everyone. Welcome and thank you for joining us this evening. My name is Sonia Hernandez and I am a organizer from Connecticut. And we are a part of a coalition, the Husky Student for a Dream, Ministerial Health Fellowship, and Health Equity Solution. So we make a coalition, health equally for the people, by the people, and we invite other communities to fight for affordable health care for expanding Husky in Connecticut Medicaid system. About in the bottom of the chat, we're going to share with you all a flyer about our coalition, and like that you can find more information about our coalition. So once again, welcome and thank you for joining us on this workshop. Tonight we're going to learn together how to navigate on the healthcare system. At the same time, we're going to share with all of you that we have some future oncoming workshop that will be learning how to write a letter or a storytelling. At the same time, mock public hearing and testimonies. Those workshops will be posted on the chat. Also, we're going to have Spanish interpretations. So if you are using the computer, you will see the little word in the bottom of your computer. So you can press that and select your language, either Spanish or English. And then you have to mute the original audio so you can hear better. And if you are using your phone, you will see in the bottom of the screen 3 little dots, and then you have to press it and you will find the interpretation. Thank you and hope that you can learn together with us in this workshop. And I will pass it to Dawn for she can introduce our interpretation person. Thank you.
Good evening, everyone. Hello, my name is Dawn Fuller, and I am the Community Engagement Specialist with Health Equity Solutions. And as Sonia mentioned, with Make the Road Connecticut, Connecticut Students for a Dream, Ministerial Health Fellowship, and Health Equity Solutions, we have formed a coalition, Health Equity for the People by the People, HEPxP. We are a coalition of Connecticut-based organizations working to make healthcare more affordable by organizing Black, Brown, and immigrant communities to fight to expand healthcare by increasing Medicaid income eligibility and including all citizens regardless of immigration status. We really want to hear from you. Your feedback is invaluable. And at the conclusion of the workshop, we will have a link to an evaluation with just a few questions. Please complete the evaluation. Again, we really value your feedback. During this presentation, please stay muted and hold questions until the end of the presentation, where we have set aside a generous amount of time for questions. Once the presentation is finished, you can raise your virtual hand or questions can be put into the chat. Again, during the presentation, please stay muted. To get us started, we have 2 polls for you tonight. And I'm going to launch the first poll just to get us started. So are you a vanilla person or are you a chocolate person? People are voting. Thank you. I'm going to give the poll a couple more seconds. All right. Let's see who won. Looks like chocolate won this one. Now, we have a poll that's a little bit more serious, and it's about health insurance. I'm going to ask you to pick all the different ways in which you are able to pay for any medical services that you have done. And we'll give you a good 30 to 40 seconds to complete this. We have a good chunk of people that have completed the poll. Thank you. Give it a few more seconds. All right. Let's see what the results show. It looks like the results show that a majority of people on this call receive their health insurance through an employer, and then followed closely by receiving coverage through Husky and Medicaid. Thank you so much for sharing. So why is that important? Well, because we're talking about healthcare tonight, and especially how we navigate healthcare. And I'm going to introduce our speaker, Sarah LeMaster. She is the Manager of Government Relations and Public Policy for CHC-ACT, which stands for Community Health Centers Association of Connecticut. And she manages legislative policy agenda as well as administers the grant program for certified application counselors. Prior to joining CHC-ACT, Sarah worked with a public affairs consulting firm whose largest client was Access Health Connecticut. The team planned and executed their community outreach plan for the 2018 open enrollment period. Sarah has spent most of her career advocating for the advancement of progressive public policy. Sarah hikes, runs marathons, and is an avid baker. And we thank you for leading this discussion tonight, Sarah.
Well, thank you so much. I really appreciate the opportunity to speak. Am I supposed to be in spotlight view? I'm sorry, I can't see myself. All right.
We can see you.
Okay, perfect. All right, sorry. I haven't done Zoom webinar that many times. I also have on here Judy Gaudette. She is the Systems of Care Director and the Health Informatics Liaison at Generations Health Center in Willimantic. She has a wealth of knowledge about signing people up for health insurance. She generously offered part of her evening to join us, so I just wanted to say thank you. With that, I'm going to go directly. I prepared some slides. I think I need permission to screen share.
Oh, my apologies. Let me take care of that right now.
So again, thank you. Thanks everyone for joining us tonight. And I really appreciate the opportunity to why can't I see my, I'm sorry, I'm having trouble finding my slides. There we go. I really appreciate the opportunity to share with all of you the some of the knowledge that I have about our healthcare, or at least about the amazing work that we do at our community health centers. I think one of the things I'm most proud of is throughout the pandemic, our community health centers continued offering services to all of their patients. They continued to offer healthcare to patients and sign people up for health insurance. So just a little bit about the Community Health Center Association. Our work is to advance and align the work of federally qualified health centers with stakeholders to improve the health and wellness of all. We really aim to help health centers do what they do better. So federally qualified health centers are There are 17 of us throughout the state. They operate in places that are health professional shortage areas. So those are places with not a whole lot of doctors and nurses. So if you, I always take a look whenever I'm going out to visit a health center, because I look around the neighborhood and I notice there aren't any dentists there. It's very rare that I see a doctor's office or anything. So really, we're there to really support the community and offer healthcare to people who have a hard time accessing it. Health centers offer care to everyone who walks through their doors. And what that means is that everyone who walks into a health center is eligible to receive care, regardless of their ability to pay. We also serve, we're also in, health centers are also entities of the healthcare system that don't discriminate. We offer healthcare to everyone. I know that sometimes people from marginalized groups have trouble receiving care in a traditional doctor's office. Our health centers serve many people who are considered homeless. They serve many people who identify as LGBTQ. They serve many people who are undocumented. So really, they serve absolutely everyone that walks through their doors. And we can talk a little bit about eligibility a little bit later, but there are 17 health centers in Connecticut with over 100 locations. Our health centers operate a lot of, we have school-based health centers that offer healthcare to children in schools and areas that we serve in. We have clinics everywhere. Throughout the pandemic, we used mobile vans and other things to administer testing. Our health centers have also vaccinated over 300,000 people in the state against COVID-19. We were part of the front lines really at the start of the pandemic, and we were able to continue working really shoulder to shoulder with the state in fighting against the virus and making sure that communities were kept safe and informed. Also, the majority of health center patients receive Husky benefits. I think about 14% of patients receive commercial insurance. The majority of our patients do receive Husky benefits.
Excuse me, Sid.
Yes.
Are you able to maximize your slides by any chance? Maybe put it in slide view? Some people are having some challenges seeing.
Is this better? No. Sorry, I apologize. I am
So we can just go forward.
Okay, I apologize. I haven't done Zoom webinar before, so it might be. Hang on one second. I think I know. Is this better? No. Wait. Sorry. Is this better? No.
I think it'll be fine. Thank you so much.
Okay. Apologies. I don't know what it looks like on the other end. So I will also send these slides to Dawn that she can share out after the presentation's over. Like I said, I haven't, most of my Zoom meetings are all in person at night. Anyway, that's neither here nor there. So what do health centers do? Health centers offer same-day primary care, dental care, and behavioral health services. What that means is that if you are a patient of a health center, if you go through the intake process and become a patient of a health center, and you go through all of the things you have to do to get to a single doctor's appointment, you're able to get all of those appointments on the same day. So we're capable of scheduling people for your primary care visit, for a dental exam, and for a behavioral health visit if you need to talk with a counselor. They do this because they're aware that it can take a lot of work to get to a single doctor's appointment, and time is very precious. And especially for health center patients who sometimes experience difficulties getting transportation or access to childcare, getting someone in the door to see a medical provider, we recognize that takes a lot of work, and we want to make sure that when you're in the door to see a medical provider, you get as much care as you can. And it's really important to us because that way we're able to prioritize the whole patient. We offer a broad range of services, including immunizations, COVID testing, and vaccination. We offer prenatal services, pediatric care. A lot of our patients are children. And we also do a lot of community-based services. Some of our health centers operate homeless shelters. They'll do food distribution during certain parts of the year. They offer diabetes management, substance abuse treatment programs. So we really, health centers really, we respond to the needs of the community. So if a community is in greater need of a certain program, health centers are there to step in and say, we will help you manage these different these different healthcare issues that you have. So just a little bit deeper into the demographics, and I think this focus is kind of a little bit more on some of the questions that Dawn asked before this presentation. There are 400,000 patients that health centers serve every year, or 400,000 residents that health centers serve every year, and that includes everyone, including people who are uninsured, including people who are undocumented. We don't ask people about their citizenship status when we're doing intake. So this represents everybody, and about just over half of those people are at or below 100% of the federal poverty level. And I'll get into what that means a little bit more later. About 61% of our patients receive Husky. We have 15,000 patients that we serve every year who experience homelessness. Our health centers serve about 1,500 agricultural workers every year. And then we also serve 26,000 children in our school-based health centers. So I wanted to also mention that health centers we really work very hard to protect patients. And what that means is that we sometimes do collect data to comply with federal guidelines to determine whether people can qualify for financial assistance. But we don't collect or report data on immigration status. It's very important that we protect everyone that walks through our doors, and we don't collect any of that information. Additionally, all patient-specific health information collected and stored by health centers is protected under the federal HEPA statute. So that means that any individualized health information will not be reported out to anybody else. So health centers really, we really prioritize protecting our patients and really taking care of people, really focusing on public health. And we recognize that part of focusing on public health means that we need to address the immediate problems that people have. And if we focused instead on whether or not you're making enough money to afford healthcare, well, we couldn't treat you because a lot of the people that walk through the doors of health centers can't afford commercial insurance. So, and we provide incredibly high quality care. We're very proud of the fact that our patients receive incredible care at our health centers. So just a little bit about healthcare for the uninsured. Health centers operate under the federal 330 grant. They receive a large amount of their operating expenses from this. And under this grant, health centers offer what's called a sliding fee scale. So this means that they serve everyone who walks through their doors, including people who are uninsured, including people who are undocumented. Patients who are uninsured or underinsured are charged based on what they are able to pay depending on income. Health centers receive funding through the Health Resources and Services Administration. This is a federal agency to offset the costs of caring for people who are unable to pay. And we write off these remaining costs in their budgets. This is referred to as uncompensated care. So just a little bit more about the sliding fee scale. We are required, like I said, to operate in a manner such that no patient shall be denied service due to an individual's ability to pay. Health centers must prepare a schedule of fees that is consistent with local rates and prepare what's called a sliding fee discount schedule. Health centers are also able to help patients access discounted prescription drugs under the 340B program. One example is we help patients afford insulin, which can often be very expensive, and other medications under this program. So this is going to get a little bit into the nitty-gritty of explaining federal poverty guidelines. I realize this may be a little dense, but I included this just to kind of explain what the numbers look like. I realize this might be really small, and I'm sorry, but I will just summarize what this chart means. So the numbers that you see in here represent 100% of the federal poverty level. So under the grant that health centers receive, a full discount is provided for individuals and families with annual incomes at or below this level. So if you are a family of 4 and you make $26,500 as a family or less, then you are at or below 100% of the federal poverty level. So the sliding fee scale means that partial discounts are provided for people who are above this level, but below 200% of the federal poverty level. So if you make $26,500 per year, or if you make $27,000 per year, you would still qualify for a discount. It wouldn't be as big as the discount you receive if you make only $26,500 per year, but you would still receive a discount, and so on and so forth. That they do cut discounts off when annual income is above 200% of the federal poverty level. So kind of getting into when you go to a health center and need to enroll in health insurance or need help figuring out what you qualify for, every single health center in Connecticut has certified application counselors that help people enroll in health insurance. These certified application counselors and Judy at Generations helps to train a lot of these people, and she supervises a lot of this CACs at her health center. They're trained every year by Access Health Connecticut. So they go through, Access Health has a rather rigorous training program that they go through. They're all required to pass an exam before they're allowed to enroll people in health insurance. So CACs at our health centers, they've enrolled tens of thousands of people in health insurance. I know that during the pandemic, we saw a lot fewer patients, but certified application counselors at every single one of our health centers were still enrolling people in health insurance, in spite of the fact that people just weren't seeking care. They were very persistent, and they made sure that anyone who needed health insurance could come to them and sign up for health insurance. They enroll people in Husky as well as commercial insurance that's available through Access Health CT. I think that Access Health has a couple of carriers. I think it's Connecticut and Anthem. I want to say, I can't remember what they are, but they can enroll if you qualify for commercial insurance, you can enroll in that. I also wanted to mention that recently the Connecticut established the covered CT program. And that's actually benefited a lot of people. It has adjusted the income qualification guidelines for subsidies under Access Health. What that means is that prior to this year, if you were on commercial insurance, but you couldn't quite a lot of times you couldn't quite afford it because the premiums were very high. Under the Covered Connecticut program, there's a very large subsidy in there, and for a lot of people who get commercial insurance, that subsidy is very low or almost nothing. So health insurance is more accessible now than it was before. I know that I have some people in my orbit who would say that it wasn't practical for them to purchase insurance because it cost them more than what their yearly doctor bills were. So it made more sense for them just to not have health insurance because they could afford, their primary care visit or their dental exam, and that was cheaper. So fortunately now under Covered Connecticut, people have better access to health insurance. I'll also note that our certified application counselors often speak languages other than English. I try to do a survey every year, and I'm always amazed at how many languages people our CACs are speaking out there. A lot of them do speak Spanish. I know that we have quite a few that speak Haitian Creole and a number of other languages. So help is available in many different languages at our health centers. So that's the conclusion. I know that Don said that we have a generous amount of time available after the presentation for questions. I know that you probably have a lot of questions, so I think Judy's still on, and hopefully we'll be able to answer questions. Or if we can't answer a question, I will follow up with Don and get her an answer hopefully by the end of the day tomorrow if I'm not able to answer something. So.
Thank you, Sarah.
Thank you.
That was a really great introduction. A lot of information that we got. So now we're gonna have a little time to ask some questions. So please, we remind that if you want to ask something, just you can put it on the chat, or you can use the fictions and raise your hand to answer some questions. Also, we want to remind everyone that please do not go right away. We finish our presentation because we're gonna give like 5 minutes to do a survey. Like that we can know your experience and know what you learned and how was this training and how we can improve for next time. And I will pass it to Sarah back if we have any questions or in the chat, or you can raise your hand.
I'm not seeing. Oh yes, Judy. Sorry. Yes.
I would love to share some information while we're waiting for people to ask their questions, because sometimes they don't know the questions that they have. So I think it's really important to share some of the other aspects of community health centers that are kind of little known for people. One, I know one of the questions that Sarah asked me about was interpretation services, if someone who is non-English speaking. And anybody who is a federally qualified health center, we are required by our grant to have policies in place for cultural sensitivity and for interpretation and translation services for those who are non-English speaking. So if you are going to any of the federally qualified health centers that are telling you that they cannot provide that, then you definitely should go to the healthcare advocate about that, because it is a requirement and they have to make sure that they are providing those services. Also, one of the questions was the question of having to fill out a financial application before they're able to schedule an appointment. And so whether it's yourself as an individual or someone you're working with, it's really important to drill down in a conversation, because oftentimes people who either are non-English speaking or have trouble understanding some of the English language don't realize that it's not a financial application, but what it is, it's the form that we have to complete for the federal government to qualify someone for the sliding fee discount that we're required to provide. And that's the one that Sarah was talking about that gives everybody a significant discount in the cost of the healthcare services that they receive at the federally qualified health centers. And we want to make sure we're doing that for everyone, because anybody who needs healthcare services should benefit from that discount and not be charged full price for services by not having that form completed. It's information that we use just to find eligibility. It is not something that we share with the government. Like Sarah said, it doesn't go to immigration services, anything like that. We don't care if someone is documented or not. And what's really important to understand is the federally qualified health centers provide services that your private practices don't. We have a lot of wraparound services, and anything that we can't provide, we have community partners to make sure we provide for. We have special grants for special populations. And all health centers are not the same. Some of us have different ones. But for the health centers that I work at, we also have a migrant and seasonal farm worker health program. And so if you happen to be an agricultural worker, or if you happen to work with someone who's an agricultural worker who doesn't know where they can get healthcare services, throughout Connecticut, there are various agencies in federally qualified health centers that have the Connecticut River Valley Farm Worker Health Program. And that program allows agriculture workers to receive medical, dental, and behavioral health appointments in those health centers at no cost to them, just by simply enrolling through that program with us. We also, in many of the health centers, specifically I can speak for ours, we have contracts with Quest Labs. So if one of our individuals who's uninsured, underinsured, or undocumented needs, let's say they're diabetic and they need lab work for glucose or for hemoglobin A1C, we have a code that we use, and whatever, as long as they're eligible for the sliding fee at the federally qualified health center, they can have that lab work done free of charge. And so it's really, really important that they're making sure they're having these conversations. It's really important at Generations too, we don't think about just cultural sensitivity, we think about cultural humility. And a lot of people don't understand what the difference is between that. But being sensitive to someone's culture is great, but having cultural humility lets you identify your own biases and make sure that you are setting them aside so that you treat every individual coming through the door as a human being, because after all, that's what everybody is first. The color of your skin, the place that you come from, or any illness that you may have, those are all consequences or circumstances. That's not who you are. You are first and foremost a human being. And so that's where the cultural humility comes in. And I think that's a very important component of community health centers. We really pride ourselves on advocating for individuals that are in disparate populations, or not getting the services that they deserve. So there's so many other things that qualified health centers can do and will do for our population. I know for my department, I have all of the special populations, community health workers, and care coordinators, which deal with our very high-risk patients. We also have an HIV clinic and a HEPC clinic. So I would say anybody who's looking for healthcare and feels that they don't have access to it, look for your nearest community health center. Any federally qualified health center should be there to help you and be able to guide you. And most of them have what's called a care coordinator or community health worker that can actually hold your hand to help you navigate that neighborhood.
So it looks like there's a question in the chat. They want to know, how were behavioral health services expanded during COVID, and was there an increase in the service? I can speak to that, or Judy, you have more on the ground experience than I do.
Yeah, I can say, speaking from our health center and in some of the calls that I've been on, they did similar things. Our behavioral health services increased tremendously because we were now allowed to do the telehealth services for behavioral health. And particularly when we're looking at our homeless population and our agricultural worker population, our agency purchased track phones that had data on them. So we actually brought the phones and delivered them to patients who didn't have access to virtual visits. And they were able to utilize those phones to make contact with a provider in a video visit. And they kept the phone afterwards so they could continue those visits and be able to get those services. And what was really great about that is when you're looking at some of the underinsured and undocumented populations, some of the fears about going to the doctors are, I can't afford to be out of work. Or if they're a migrant farm worker that's coming over with the Department of Labor on a contract from, say, Haiti or Mexico or some other area, then they're fearful that if they take that time off, that they may not get the contract next year. By enabling this service and doing the telehealth, we were able to go there where they are, give them the phone, help connect them to the provider. It was minimal time that they were out of the fields or out of whatever position they were in, and they were able to get the services they need, wrap it up, and immediately go right back to work. It was amazing how many of the employers were willing to work with us on this, and we were able to provide those services.
And I'll also add to that, we did a study with the University of Connecticut on telehealth, and one of the findings was that that expansion of telehealth services, or telehealth has been an incredible tool for behavioral health services. I know that prior to the pandemic, health centers offered behavioral health services, but it was more challenging to get patients to behavioral health services because they had to be in person because we weren't allowed to do telehealth prior. Sorry, I'm looking at the chat and I'm distracted because I see a really good question in there. So having access to telehealth has really just expanded our ability to offer those services. I will also advocate that that while behavioral health and telehealth has been a really powerful tool, we're currently concerned about those benefits changing based on what the federal government does. So I may be reaching out to you in a couple of weeks to ask for some advocacy to make sure that telehealth is codified, because I know how important these services are. I see another question about, I think I'm going to badly interpret this in Spanish, but they're asking if their health history affects their eligibility for insurance. I think that's what Maria's asking.
Yeah, the answer is absolutely no. The Affordable Care Act restricts anyone from being omitted from eligibility for insurance based on previous health history.
I also, while we're waiting for more questions, I wanted to show everyone how to find a health center. So I'm going to screen share once again. So this is the Community Health Center Association website. This is I can put this in the chat. It's chcact.org. You can go on here and you can click Find a Health Center. And this will take you to an interactive map of where all of our health centers are. So if you, we have, as I said earlier, our health centers operate largely in places where there aren't a whole lot of doctors and nurses and other care providers. And while there are quite a few care providers in places like Hartford, our health centers operate in neighborhoods where it's hard to find these services or where it's hard to get to these services. So you can go on here and you can either select a region or you can put in your address, and this will give you a list of health centers that that are near you. Here, I'll put in. We'll just try a random address, and this will show you. Okay, these are the health centers that are in your neighborhood or that are close to you, and all of the things that we mentioned earlier, the services and signing up for health insurance and medical, primary care and dental care and behavioral health, those are all available at health centers within your neighborhood or health centers that are close to you. And it looks like we have a question from Helen. Helen, can you please unmute yourself?
Muy buenas tardes.
Yes.
Ok, gracias por la información y me gustaría tener, mi pregunta está basada sobre un ejemplo, me gustaría tener un ejemplo. Soy una persona indocumentada, no tengo idea de por dónde empezar para tener un seguro médico. ¿Qué debo hacer? Ir directamente al centro comunitario y hablar con alguna persona en una oficina. ¿Debo llamar por teléfono? ¿Cuál es la acción que debo tener como para poder saber por dónde empiezo, qué documentos debo llevar, cómo debo empezar el proceso en sí para poder acceder a los servicios de los centros comunitarios? Me gustaría que me lo pudiera responder con un ejemplo igual. Gracias.
Judy, are you able to take this question?
Okay, so my Spanish is not that great. So if someone can give me a synopsis, then absolutely.
I apologize. There's an interpreter, and if you go to the bottom of your screen, and it to the EN, well, anyway, her question, I can summarize her question. It was if, so she's an undocumented immigrant, and her question is, how does she start? What are the steps that she needs to follow to go to a health center, and what information does she need to bring with her to see if she qualifies for health insurance?
Sorry, I was muted. Undocumented and has not been in the US for a period of 5 years or more, then you do not qualify for health insurance. However, that doesn't eliminate you from health care. Any undocumented individual seeking health care can go to any federally qualified health center. All you need to do is walk in, fill out the intake form, and do the eligibility form for the sliding scale fees. And we don't turn anyone away, regardless of their ability to pay. And we serve everyone from pediatrics to geriatrics, so anyone from pregnancy to birth and up through end of life care. Federally qualified health centers all have family practitioners, and we'll see everybody. So don't not get healthcare services because you're worried about your documentation status or because you don't have insurance. That's what we're there for as federally qualified health centers. And we want to make sure that you're coming in and getting the services you need.
Helen, do you have an additional question? I see your hand is still raised.
No, sorry, thank you. I got it.
Thank you. Alejandra is asking about what if someone doesn't have a job, what do they do?
It's the same thing. You come into the community health center, and if you don't have a job, you can just tell them you don't work, and that's what your sliding fee is based on. I can't speak for everybody, every community health center's cost, but what I can say is at Generations Family Health Center, we have all of the northeastern area of Connecticut. We have 4 different health centers, and for anybody who is below 100% of the federal poverty level, so that's pretty substantial for a large family, or if someone is without income, then any service you come in and get is reduced to a $20 fee. So you could come in as a female and need your annual physical and your female exam, and let's say you're diabetic, and we can do on-site testing for blood sugar levels, and we can check your iron and all of those things in one visit in the office, and you could still walk away with a $20 cost. That doesn't mean you have to pay that day, and it doesn't mean that you have to pay all at once. We will not turn you away because you can't pay. So if you tell us, I'm sorry, I don't have the money, I can't afford to pay that, then we'll work with you down the road. But you should never not come in because you don't have the money to pay for it. You should always come in.
Thank you. It looks like Bianca has a question. Your hand is raised.
Hi, good evening. I hear one person that they try to go to a community health center. And when they go there, they ask him for the papers of the children, and he start to be scared because their children are citizens, and they start to ask for their information, social security, and he start like he was scared So he stopped to the process and he didn't want to come back anymore. And I want to understand more these what this happened.
So this is something we run into a lot. When the children are citizens and they have social security numbers, we're asking for that information so that we can get them the Connecticut Husky insurance. We want to make sure that they get the insurance that they're eligible for, and it will cover all of the costs that they need related to the child's health care. It does not have any bearing. We don't need to look at the documentation status of the parents, because when you're applying for a Husky, it is in the individual's name. So even if your child is 6 months old and we're applying for insurance, it goes in that child's name and not in the parent's name. So there's no worry for fear of deportation or being reported to immigration or anything, because that information is confidential. We only use the child's information to obtain that insurance for them. Does that answer your question?
No, sorry. The person, their children already have the Husky,
Okay, if the
but
children
they still need their personal information, and that's why the person stopped running.
Okay, so if they're looking for personal information, what we call the demographic information, like name, date of birth, social security number, that is simply for the federally qualified health centers to enroll them as a patient in the health center. And that information goes nowhere. That's just what we keep, so that if they have the insurance with the state, we have to, that's what we bill the state under for that insurance purpose. And that's all that the information is used for. So we can't really treat people if we don't know who they are. And we also have to make sure that, if that's the child that we have in our system that is dedicated to that insurance card, we need to make sure that it's the right child with the right insurance information when we're billing it out to the state, so that we're not billing incorrectly.
Thank you. Thank you so much for that answer. We have another question from Larace. They're asking, do you study the development of youth who have traumatic experiences? I have a wild guess, but Judy, do you have any comments on that question?
Yes, that's actually called ACEs. That is adverse child experiences. And we definitely do study it. It is something that is screened annually for all of our pediatric population, and our mental health services rely heavily on it. Interestingly enough, my staff that deals with the high-risk patients were required to take a training called Resilience, which is a video, and it's the real life stories of people who experienced adverse childhood experiences and how it affects them in adulthood and leads to a lot of things like mental health and substance use issues and all of that. So if you ever have the opportunity to see that, it really sheds a good light on that, and I would recommend it to anyone. Yes, you can absolutely contact me. I will put my email in the chat. So if anybody wants to reach out, you can reach out via email.
Are there any other questions? What other questions do people have for myself and Judy?
I don't see no more, but I do have one. If you can tell us what kind of programs they have each of the community center and what it covers once you apply for the scale discount or any covers that they give it the community.
Okay, so I want to change one of the words you use, because I want everybody to understand. When you fill out the form for sliding fee, you are not applying because you are coming to a federally qualified health center. You are automatically eligible to complete the form to see what your costs will be. You don't have to apply. All we need to do is have you tell us what your income level is, and based on that income level, that is how we figure out the rate. And if you are, extremely under 100% of the federal poverty level, then it's extremely limited as far as what you would be charged. For undocumented individuals, there's various services, and it depends on if they are seasonal workers or not. If they're undocumented and they work in the agricultural field, anything, like whether it's the actual fields, chicken farms, cow farms, things like that, then they are eligible for a special program called the Connecticut River Valley Farm Worker Health Program. And that provides a broad range of services where they can get free medical services, and we're also able to, apply for other services. I can't speak for all health centers, but I know at Generations, we have a lot of wraparound services. We constantly get grants to assist with purchasing things like blood pressure cuffs and thermometers and scales, even for people who need to lose weight or who are diabetic. And so we try to provide as much as we can, but documented or not, it doesn't matter. You are entitled to the exact same healthcare services that a person who has the best insurance deserves, which means anytime you come in, whatever your health issue is, we're going to address those issues and treat you just like we would everybody else.
That's a great answer. And I'll add to that health centers don't treat patients who have commercial insurance or Medicaid or on the sliding fee scale any differently. Every patient is treated the same. There isn't, in addition to that, all of the things that we've talked about, behavioral health services, telehealth services, dental services, and all of those things are included when you become a patient of a health center. So I think another way to answer that question is anyone who is a health center patient, regardless of whether or not you are documented or not, if you are a health center patient, you will be treated the same as every other health center patient.
I just want to make a statement to everybody who is either themselves had an experience with trying to get healthcare or works with people who do. It's really apparent in a lot of the work. I've been with the Community Health Center for almost 20 years. And over the years, I've run into a lot of cultural and ethnicity backgrounds that have fears about coming into the health center or talking to someone, especially when we start talking about things like substance abuse, alcohol, mental health issues. There's the stigmatism around those things are so significant, especially in some cultures, that people are afraid to go for the help. And I just want everyone to know, as soon as you walk through the doors of a federally qualified health center, you are a human being. We will treat you. You can talk to us about anything. We are not there to judge you, and we are going to make sure that whatever services you're seeking, we're going to try and make sure you get.
Thank you, Judy and Sarah. And I don't think we have more questions with the everybody's really have a great information and the service that you do. Thank you for sharing with us today. And we're gonna have the last 4 minutes. Hope that everybody enjoyed this wonderful workshop, and we appreciate your attendance, and we want to hear from you. So right now we're gonna spend like the 4 last minutes completing a evaluation that we're gonna put on the chat. So please take this time and fill it up. We wanna hear from you. What was your experience and how we can improve for next time. And
I think Helen has a question.
yes.
Oh,
Helen.
me gustaría saber si el programa cubre algunas especialidades, como por ejemplo especialistas de pulmón, de corazón, y además si también pueden ser cubiertas algunas exámenes especiales como CT scan o resonancia magnética.
So they, it's not a program that the health center is, we're a federally qualified health center and we receive funding to provide the care. When we're looking at specialty services and hospital services like CAT scans and things like that, we actually have staff that contact the hospitals and negotiate a self-pay rate, which is significantly reduced. So it's affordable and they can be set up on a payment plan. And for Generations, we also do that for specialty care. But at Generations, I think we're very unique in that we have what's called a patient assistance fund. And so the employees at our health centers, we have 239 employees, and out of each paycheck, we put money into a fund that we utilize. It's called the Patient Assistance Fund. And so when a patient who is uninsured or underinsured needs those services like specialty care or prescriptions that they can't afford or a CT scan, if they're within the income guidelines and they don't have insurance, we use those funds to pay for that for our patients.
Thank you, Helen. Thank you, Judy, for answer. So let me make sure that we don't have the hands raised or any other questions. I think, Dawn, you can put that on the chat, the survey, please. Okay, so give us 1 second that we're gonna. Just waiting for them to post. So we are having some issues that Dawn cannot post it, so I will add it there. So thank you everyone for being patient. Please give us some minutes. Thank you, Judy and Sarah, for this wonderful presentation, and Jacqueline for help us with the interpretation. So we are having some problems like Dawn got freeze up and she cannot share the survey. So what we're gonna do is we're gonna email to each of you that was present today, like that you can give us your opinion and your feedback. And we wanna thank you everyone to join us today. So thank you, Judy and Sarah and Jackie to help us and did this wonderful workshop. Hope that you will receive some emails, Judith, because they has a lot of more questions. And thank you everyone to join us today. Hope you have a wonderful night.
Thank you. Have a great night.
You too.
Thank you.
Thank you. Don, can you hear us? So thank you everyone for joining us.
Great workshop. Great workshop.
Yes. Hope that you enjoy the rest of the evening. And hope to see you in the next training.
Okay, I'm back and I'm ending the recording and I am ending the Zoom. Thank you, everyone.